So I would now proceed with the next session, and I'm taking the liberty of seating myself here and continuing with the invitation to the next speaker. I have pleasure in inviting Jagruti Bhatia, who is the Senior Advisor for Healthcare Advisory Practice in KPMG. She has advised and executed 400 projects across healthcare consulting spectrum, serving a very prestigious client list, and has been the COO consulting services of a boutique healthcare consulting firm, eventually leading to operations in India, Africa, and the UAE. She's been invited in the advisory capacity by the Ministry of Environment and Forests in Maharashtra and serves on the Board of Trustees for the NGO Foundation for Environment Conservation. So on the same topic of a paradigm shift, I would now invite Jagruti to speak to us on her perspectives of what her own insight and that of KPMG is in this important topic.
Thank you, Dr. Jairam, and thank you. It's a pleasure to be here with everybody, and it was lovely to also hear Sangeeta as well as the way the sessions have been planned. I think what we very relevant to what was discussed earlier. We thought that can healthcare as an industry really change the contribute to the GDP? Currently, is it the neglected GDP driver? Today, if we while it is a celebrated fact that the GDP contributes to enhancement of the health of the population, can it be that better health to the citizens can actually contribute to an improvement in the GDP? And so we had this thought leadership that we compiled together. Here the reverse, from the healthcare industry to the GDP, does the industry create a lot of employment? The productivity of the citizens will improve if the health of the citizens improves. There is so much investment that is happening in the industry and generating huge amount of forex. The entrepreneurship, scenario has opened up. If you see the amount of innovations that have occurred in the last 2 to 3 years, and as the way it was mentioned in the earlier session, moving from hospitals to mobiles to technology-driven, healthcare provisions, all this has led to a huge interest from investors all across into the industry. Now, Dr. Puri, and thanks for adding that up. When we say that one physician, earlier was requiring almost a 5.6 amount of people to actually treat a patient. And thanks for adding that now this has gone up to almost 26, as we know. Now, this means that there is a huge amount of people that are required to even treat the number of patients and the demand that we have in our country. This entire ecosystem that needs to be developed to treat this patient itself will generate huge amount of employment. If we look at the gap, from the current gap to the required gap of 14 per 10,000, that's a huge gap to fill. If we look at today, we employ almost, so there is almost 5 million population that is being employed by the industry. And the estimated population by 2020 that just the healthcare industry would employ is almost 7.4 million people. This is huge. This is like, creating a lot of employment across. And whilst we say that, mobiles and internets and advanced technologies will try and bring the people and the patient and the providers together, there still will need to be a lot of people who will actually need to treat them around. So that this is where we come from. Now, on a flip side, how does the healthcare industry really contribute to the reduction of the GDP? The healthcare, the illnesses that are there, and does that illness really lead to the diseased, the dailies, and hence, when we talk about reduction of the people and the when the population does not really go is not able to sorry when the population is really sick and we do not contribute much and to the and you have so much of absenteeism, so much of people really not getting to treat. That's when the whole. I'm sorry. So this when we talk about the people, the sick people reducing the amount of GDP, the major contributors of illnesses are, say, the cardiac diseases. As we have seen earlier, there is a huge amount of NCDs that will impose an economic burden on on India. It is estimated to the tune of 5 trillion economic burden that will happen due to the cardiovascular diseases, which will account for almost 50% of the losses that are there. And this is majorly because people will be unable to really attend to their offices and contribute to the economy of the country. This decreasing productivity and rendering the economy frail highlights the need to focus on preventive care. Can we really prevent the, the cardiac diseases and other contributors of diseases to really bring the population to a healthy lifestyle? And obviously, there can be many, areas of intervention which can be looked upon. Many of them will be, to come collaboratively to work together. Many of them will be to introduce the Ayush practitioners into the main system and look at different solutions. The other, contributor why, the industry is contributing towards, the improvement in the GDP is also the medical tourism and the medical value travel that is there in coming inside the country. The sector in the recent past has also seen a huge amount of influx of investors. If we look at it, in 2015 itself, if we had an investment of almost 3,100 million US dollars going into the industry. This was in all formats, not just the provider space, but also diagnostics and various other formats. Innovation is another area where we actually are considered to be one of the the countries where innovation, it is the bed of innovation, if we can put it. Now, when we are known very internationally, if we are known very well for the IT innovation that really has taken place, but today we also are getting to be known for the healthcare innovation that is taking place. There are case studies across with the various healthcare providers as well as any other technologies that is being imbibed by many others. Innovation in healthcare has also led to a lot of interest in the investments that have happened. The innovative healthcare approach has also, is also boosting the GDP of the nation in various formats. So if you look at, reduced sicknesses, if you look at, centralized hospital care, the sickness-oriented, approach, there are various interventions that have happened, and these definitely have contributed to a better improvement in the GDP. In a nutshell, not to take too much time, is that the inputs required for a stronger healthcare system will help us to produce better workforce, a more, a more healthier population, which will have much better contribution towards the improved economic situation. The healthcare industry itself, has a huge potential for large amount of employment generation, the improved productivity, huge amount of exports which generate a lot of forex generation for the country, and the entrepreneurial environment attracting many investors as well as venture capitalists to really put in the money. This is where we see a huge GDP growth. This is where we see that if the industry as a whole can come together and contribute towards working towards the health of the population, towards improving the health of the population, whether the intervention is in the format of diagnostic services, in the format of healthcare providers, in the format of new innovators that are there, I think it'll make a huge difference. And I think together, if we, like we had said earlier, is the industry today may be plagiarized with many issues where ethics and various other things are questioned. Is it at this time that can we come together and put up a strong force that this is where we stand, this is where we are contributing towards the GDP of the nation, and hence we need to be recognized and seen as a strong collaborative force together. So that's where I think we come from. I think that's where we wanted to say thank you very much for being here.
Thank you, Jagruti. I am going to suggest that we'll keep all the questions to the end of the following panel discussion. So I would request Jagruti to answer at that point in time. Without further ado, can I request the panelists who are seated here to come on to the dais so that we can start the next session. Ladies and gentlemen, there is a galaxy of panelists who are here this morning to speak on this thematic topic. It is my privilege to introduce each one of them to you briefly before we proceed. Mr. Bhaskar Iyer, who is to my immediate right, is the Vice President of Abbott, and prior to that was the President, India and Emerging Markets for Wockhardt, and also has had a stint with AstraZeneca in the Asia-Pacific region based in Singapore. He's also associated with a number of charities, including the Navjeevan Blind Relief Center, the Narayan Seva Santan, World Vision, and the Cancer Relief and Research Trust. He's a microbiologist and a chemist from Mumbai University with a marketing degree in marketing management, also from Mumbai. To my left is Mr. Bhavdeep Singh, who is the CEO of Fortis Healthcare. And before his tenure with Fortis, he was in Ahold and served on the company's executive board. While there, he was initially Executive Vice President HR and went on to head the company's US operations and new formats. He's held several senior executive positions in HR, retail, and healthcare, and has worked through multiple geographies. He attended the Pace University and completed several certified courses in leadership management from premier institutions including Harvard, Cornell, Hartford, and St. Joe's universities in the United States. Dr. Bakshi, who is to my right there, this CEO of Manipal Health Enterprises, was earlier with Max as its CEO and was elevated to becoming its managing director. He's also worked with Wim Hans, the Drexel University College of Medicine, Philadelphia, and McKinsey. He's got multiple hats, and he wears, at this point, the administrator's hat, but he's a neurosurgeon, a stem cell scientist, a strategy consultant, and a managing director, all put into one. He's a product of AIMS and has done his MCH from that illustrious institution. On my left, the second person on my left, Dr. D. Kuntia, is Vice President Medical Affairs of Varian Medical Systems and has served several key roles in regulatory affairs, product development, and clinical research. Prior to joining Varian, he was associate professor at the University of Wisconsin. He serves on the board of the American Board of Radiology as its examiner and also on the board of directors of Medical Physics Publishing. He's on the editorial panel of multiple oncology journals and continues to be involved in research and is a principal investigator in a number of RTOG trials. He's a doctor of medicine from the University of Illinois and has worked at the Cleveland Clinic where he did his residency. Dr. Somil, and he's to my far right, is a familiar figure and a friend of this group, and currently the senior health specialist at the World Bank. Everybody remembers his stint at the IRDA in India, where he did yeoman work in many areas, and is currently also on the board of the NABH and the governing council of IRDA's Health Insurance Forum. He is also on the Health Insurance Advisory Board constituted by FICCI and has served in the Ministry of Health and Family Welfare and the National Commission on Macroeconomics and Health, the WHO, and the Indian Ministry of Finance. Founding member of the Joint Learning Group for Universal Health Coverage, he has recently authored several publications on health financing and health insurance. And on my extreme left, another friend of FICCI's, Mr. Rajendra Gupta Pratap Rajendra Gupta, is chairman and board of directors of HIMSS Asia Pacific. He has drafted the election manifesto for the BJP in 2009 and 2014 under the chairmanship of Dr. Murli Manohar Joshi and has served on the advisory boards of and several boards of the largest global corporations. He has been active in lecturing across the globe and writing articles and has served on several advisory boards across various countries, including the United States. He holds a master's degree in leading innovation and change from the United Kingdom and a bachelor's degree in science and social sciences. So as you can see, ladies and gentlemen, not only do I have a galaxy of people who are going to speak to us, but the diversity of this group is obvious and appropriate. There are people from the provider segment, from the medical technology segment. There are also people from the World Bank, from the government, and some from practicing medicine as well. Let me pause here to say, why are we discussing this topic and what is so important about the need for a paradigm shift? We've spoken about this yesterday. There have been people who have extolled the importance, the value, and the way forward in this. But why are we talking about it? We are talking about it because as we seat ourselves here, we are chartering the way healthcare will move in this country. All of us know that the economic change that this country has witnessed, and wonderfully at that, is what is driving this change. Had this economy not moved at the pace that it did, we wouldn't have a problem to discuss. In short, this is a good problem to have, but the way we discuss this and we write the book for healthcare in India in the next decade will determine whether all of us seated here have done our homework and jobs well. We also know that the healthcare industry in India is not regulated to the extent or the appropriateness that all of us wish. And much of it is determined by private healthcare players whose vision and whose forward thought would dictate 70% of what is going to happen in this industry. It is obvious from what has been stated that there is a change in the disease pattern, and 60% of what India suffers from, and which is described appropriately as a tsunami, is NCDs. The cost of care in NCDs is much more, And many of these costs continue to plague the person for his entire life. And therefore, there is an importance and value in determining how healthcare spends can occur. There is the issue of an ever-changing practice of medicine, of remote medicine and technology that is governing the way medicine is going to be practiced. The doctor of yesterday and perhaps even today is fast changing into a technology-driven instrument that would work with the brains that much was done with the cerebrum of physicians yesteryear. In this conundrum of change, also throw in the potpourri of ethics, integrity, accountability, and appropriate data, and my dear friends, you have the problem that faces you ahead. And therefore, to describe what we should do appropriately, I would call upon each of the panelists to speak about their respective industries. And hopefully at the end of this, we would have in our wish list appropriate measures that can determine how we should move ahead. I would request each of the panelists to speak for about 5 to 6 minutes so that we get a perspective of their intelligence and forethought. And then I would invite participation from the audience. I would take the liberty of a few questions to the panelists as we go along. Ladies and gentlemen, with this initial few thoughts, I invite the first speaker, Mr. Bhaskar Iyer, sir.
Thank you, Dr. Jairam. Morning, colleagues. What I'm going to largely get in a perspective, what can healthcare companies bring to the table. Having said that, I should mention there are a lot of initiatives by definition actually become collaborative between different stakeholders. I shall also, be focusing on the preventive and the promotive, healthcare aspect. All of us are aware we are moving from the Millennium Development Goals to the Sustainable Development Goals. And the time horizon for that is 2015 to 2030. I think all of us since yesterday, what we have been talking about is, the future direction. How is it going to evolve? And I think the important question is, what should be the status of healthcare delivery, say by 2030? And more importantly, what is it we need to do now to be able to arrive at that, level of the desired level of healthcare delivery? If you look at goal number 3, in the Sustainable Development Goals, a lot of them are related to health and well-being. It talks about reduction of mortality by 1/3 on non-communicable diseases. It talks about vaccination. It talks about preventable deaths, preventable infant mortality and up to the age of 5, and so on and so forth. So once again, a very sharp focus on preventive health care. I think this conversation also is about assessing what are the robust models with far-reaching impact. I think Dr. Subbaraj made a point that we still have up to 2 million vaccine preventable deaths which are happening in India. All of us are aware that one health system model does not, will not work in India. There are multiple dimensions and challenges. As a pharmaceutical company or a healthcare company, there are all along the continuum of care, we can actually make a difference. And in small and big ways, alone and in partnership with different people, we actually, try to do that. There are multiple initiatives that my organization has taken, in terms of access and awareness. We support studies along with reputed institutions and organizations on, understanding prevalence. There's a whole piece around prevention, diagnosis, treatment, monitoring, and compliance. I could speak at length at how a healthcare company can actually make a difference at every stage of this, continuum of care. I want to focus on 4 key themes for healthcare companies. An obvious one, first, awareness, early detection and diagnosis are key levers to manage, prevent the non-communicable disease pandemic. We have been talking about it. Sangeeta touched upon it very eloquently. If you look at its impact, it contributes 43% in terms of disability adjusted life years, and more importantly, in terms of mortality to the tune of 53%. I want to share a model, and I do it because it's a model that I'm really familiar with. What does Abbott do in the space of creating awareness, diagnosis, and prevention? We ran a campaign, we still run a campaign called Make India Thyroid Aware. It's a partnership with the Indian Thyroid Society. We have reached about 18 lakh people in the last year and a half, and have conducted about 10,000 camps across the country. We're also in partnership with diagnostic labs, where we collaborated with them in seeing how we could, patients could access it at discounted rates. We supported an epidemiological study, and I'll share just the key points that came out. 1 in 10 people actually suffer from hypothyroidism. A third are unaware, and the high level of prevalence, with diseases like diabetes, dyslipidemia, pregnancy, depression, and so on and so forth. Let me move from there to another example of what Novo Nordisk actually does. Again, a very commendable, achievement. Since 2002, they have diagnosed about 332,000 people. More importantly, they have diagnosed and identified 124,000 people who were pre-diabetic. They have trained in the last 10 to 12 years 86,000 HCPs and educated and empowered 800,000 people. If more organizations collaboratively with other stakeholders, we were to scale up, just imagine what impact we could really make across India. The second point, encouraging policy level intervention to bring about changes in existing norms and culture. I want to share an example of Mexico, where there was a change in culture, and today it's an example, it's a torchbearer in the global fight against obesity. The government really got down to taxing junk food, high saturated fat, salt and sugar food, by 8%, sugary drinks by 10%, and the money they collected actually went into health programs and providing drinking water in schools. And you can see the result, how dramatic it has been, when there's a policy intervention to, really embed preventive or promotive healthcare. The third one, in terms of vaccination, I think the polio vaccination program has been, quoted in all kind of forums ad nauseum. Having said that, a very commendable achievement, where more than 50% of the global cases were in India in 2009. And as a country, we managed to eradicate it completely by 2012. The power of collaboration, the power of scaling up collaboration. National immunization program. I know there's a focus on that, but again, if you look at all the challenges around it, challenges of access, infrastructure, insurance, manufacturing constraints, awareness, affordability, cold chain, provision of cold chain, the last mile distribution, the difficulty that healthcare companies have of getting newer vaccines into the universal immunization program. So all of these barriers need to be overcome before we can really begin to make a difference. Moving on from there, stakeholder collaboration across the continuum of care. It's an example I'm familiar. I'm sorry, I should have possibly picked up an example from India, but this is quite a dramatic, and I'm familiar with the details. This is a partnership of Abbott Diabetes Care that we have with the Ministry of Health in Saudi Arabia. And commitment and ownership from the Ministry of Health, really makes a difference. I don't know how many of you are aware, 14% of people in Saudi Arabia are diabetic. More than 28% above the age of 30 are diabetic. In collaboration with the Ministry of Health, we run awareness campaigns in shopping malls. Patients are allowed to visit primary health centers across the country, specialized diabetic centers, 21 centers. We have distributed 600,000 glucose monitoring devices in less than last 2 years. And we can begin to see the impact that you're making. The last point I want to make is on promotive healthcare. I think rightly our respected Prime Minister got focus and thrust on Swachh Bharat, which he announced on the 2nd of October last year. A very good example of promotive healthcare. We're talking of sanitation. We're talking of cleaner societies. Today, corporates are mandated to spend 2% of their profits on CSR. So there's a lot of scope for collaboration between corporates, NGOs, the government, and and so on and so forth. Again, the high profile, the global visibility that one has on yoga. I end with a statement which is very simple, but it's not about understanding it intellectually, but how do we different stakeholders actually internalize. I think it all comes down to commitment. It comes down to ownership. It comes down to collaboration. But most importantly, how do we collaborate with relevant stakeholders and really do it to scale to make a meaningful impact? I think there are a lot of good ideas the different stakeholders have. I think the challenge is how to do it to scale. Thank you.
Thank you for really concising within 5 to 7 minutes your thoughts on your aspects of or your industry's perspective towards this. I would ask you, Mr. Iyer, whether you have any thoughts on the current issue of ethics, because between the pharmaceutical industry and the medical fraternity, there seems to be a growing quote-unquote nexus, which is unfortunate and perhaps leading to a lot of displeasure in the community.
I like the fact that in a very forthright manner you had touched upon it in your opening statement. I believe different stakeholders, whether it's healthcare companies, whether it's providers or any other stakeholder, I don't think behaving in an ethical manner or behaving with high integrity is matter of that we have an option. It's a matter of choice. I think that's the only way we can earn the trust that we are collectively trying to make to the patient. I can say this for Abbott because I'm very familiar again with that. As a healthcare company, we need to comply with a number of codes, whether it's IFPMA, whether it's OPPI, whether it's MCI, whether it's the DOP. But possibly the most stringent, all of them, is the code of business conduct that every single employee at all times in all forums has to consistently demonstrate. So I think you see a higher level of awareness right now, and I think the way going forward is actually operating at all times with all stakeholders with the highest standards of ethics and integrity.
Thank you, sir. With that, I will now move on to request Mr. Bhavdeep Singh to speak to us.
Good morning. It's a pleasure to be here today. I want to just, I thought about this discussion this morning and thinking about what was the best way to talk about patient care and safety and what's happening on the healthcare landscape in India today. And from a conversation perspective, there's a lot of data that's available. There's a lot of data that's available in terms of what's happening in India today. And there are a lot of talking points that you can build around the data. As I thought about my experience, I was here at Fortis. I ran Fortis between 2009 and 2011. And the dialogue around patient care and safety was starting to build some momentum at that time. And as I was coming back to India, I was thinking to myself that this is going to be a bit like a Hindi movie where you step out for a couple of hours and come back and find out you really haven't missed very much at all. And the good news is, first of all, it's a good movie. So I'm glad I've come back to the movie. There's a lot of interesting things happening. The names and faces have changed a bit, but the storyline is continuing. And if you think about what's happening, think about what's happening globally, not just in healthcare, but in all industries. Transparency is a buzzword today because information is readily available to everybody at any given time for just about anything you want. And I recall back in 2009, 2010, we had started the dialogue around patient care. We started establishing metrics on just how do you define what does good patient care look like. And when you have words like care, it's tough to put metrics to it. It's tough to put numbers to it. So you start asking, what does good experience look like? In my past, I spent many years in the retail industry and spent some time in HR. And you start understanding that when you start talking about an experience, you actually have to understand and define what are the various components of that experience. So as I think about 2015 and beyond, and this movie that I've come back into, I thought about ownership quite a bit. And I've thought about accountability. We have in our hospitals, we have patient care officers. We have safety officers in our hospitals. And that's good because you have to have at every local level, when you operate in a multi-unit environment like we do, you have to have accountability at every level. But the conversations, and I've only been back 6 to 7 weeks now, that we're having inside the walls of Fortis is that I am the patient care officer for Fortis Healthcare. I am the safety officer, first and foremost, at Fortis Healthcare. Because if you're going to bring about change, if you're going to bring about accountability, you have to have a series of processes, and you have to have a series of guidelines and rules and things that people have to follow. Because you have to be able to say that if this happens on such and such day, you do this, then you do this. You have to have processes around it. But the reality is what all industries have learned over a period of time, that process without behavior is failure. And that comes down to culture. And how do you start changing the culture? How do you start changing the conversations? So within our organization, we're starting to have the conversation on how do you change the culture? How do you start having the right conversations? The reality is that we can have, we can talk about patient care, we can talk about patient safety. Ultimately, it comes down to where do you spend your time? Where do you spend your energy? And what happens is that in organizations like ours, it's very easy to start focusing on the numbers. We're a publicly traded company. Many of the companies here are. We all work on financials. But all those metrics that we report on, that everybody looks at, those are byproducts. Those are the outputs. It's the input that we need to start having a conversation on. It's very interesting. I was talking to some folks from the media a couple of days back, and they were asking about Fortis Healthcare. And they were asking about what's the plan at Fortis? Bolo na. Dr. Puri and I work together, so I've learned that. I'm getting from the back that you're. All right. Can you all hear me now? All right. Did you all hear the first 5 minutes? Well, it was quite brilliant. Those of you in the back clearly missed it. It really was brilliant. Accountability and ownership. If you have a meeting for an hour and you spend 50 minutes talking about numbers and 10 minutes talking about patient care, you get what you put in. We had a board meeting. We had a board meeting 4 weeks ago, my second week at Fortis. We had a 7-hour board meeting. And typically in board meetings, you discuss numbers. That's what we all do. We discussed patient care for 4.5 hours. We discussed how to define patient care. We discussed how you measure patient care. We discussed accountability around patient care, around safety. I own patient care and I own patient safety at Fortis. It starts with me. And that means that I have to demonstrate it. That means that every single hospital head we have has to demonstrate it. That means that every single person in this room has to demonstrate it. I started to tell you earlier, I was talking to some folks from the media a couple of days back. And then I want to know about Fortis Healthcare. So I started talking about patient care. I started talking about safety. And I'd get so far down the line, they'd say, well, that's wonderful. Can you tell us about your expansion plans? And I'd say, well, you know, we're really focusing on doing what we do well today. And I talk a little bit more about accountability and patient care and what we're doing around our Lakshya pillars. That's wonderful. Could you please tell us about your cash on hand? So I actually took them to task on it. I said, you know, every time something goes wrong, everybody attacks the healthcare industry for not doing the right thing when it comes to patient care. But you really don't want to talk about it. Our main topic needs to become patient care and safety. Because I'm from the retail industry, and the way the retail industry works is very simple. The good retailers, and this is in every industry, focus on the customer, focus on the patient. Focus on them in a systematic, predictable, replicable, consistent manner. Everything else will fall into place. Everything else will fall into place. So I am taking patient safety, patient care in a very, very serious light, starting with me. And I would go as far as to say that 6 months from now, a year from now, that if Fortis as an organization hasn't moved the needle and continue to get better, ownership starts with me. But I think similarly for the industry. You know, one of the parts here is that as an industry, we have to start moving forward too. We can only, somebody, you know, I was asked recently, what do you think about the government's role, the whole public-private partnership? Listen, it would be wonderful to have public-private partnership at its best level, at its highest level possible. But good Lord, you can't wait for that. Right? We own it. We own the outcome. When this conference ends, there isn't another group of people that are going to come in here to figure this out. This is it. We're the A-team. That's the way we're looking at it at Fortis as well. So we look forward to making a lot of progress when it comes to patient care, patient safety. We look forward to moving this discussion forward and continue to make the discussions more mature, more significant. Because what's interesting is I come from the US. I spent most of my life in the US. And the US healthcare system is going backwards. 15 years ago, if I went to a doctor, if my leg hurt, if I had a tooth to be pulled out, or if I had a problem with my cornea, the doctor would ask me, how are you, Mr. Singh? How can I help you? Do you feel okay? Today, you cannot go to a doctor's office in the US and see the doctor till you pay. Now, that's a recent shift. You actually have to pay first. That wasn't the case 10 years ago. So it's interesting because I think that what we consider sometimes the most progressive healthcare system in the world, not so much. So I think we have a huge opportunity in front of us, and I think it's time for us to move the needle forward, and certainly that's what we're going to do at Fortis. So thank you very much.
Thank you, Mr. Singh. What comes out clearly is that whatever we do, whatever we say, the Indian healthcare storybook has to be written by us for ourselves. We cannot learn from other countries, or let me put it slightly differently. We cannot cut, copy, paste the learnings of other countries to satisfy the healthcare needs of this nation. Let's also accept it. The world has not done wonders in terms of healthcare delivery. There are pitfalls locally in each of their systems, just as was pointed out about the US, so also about the UK. But there are tiny bits of learnings that you can pick up from there and apply it for appropriateness in our own system. Having said this, and thank you again for talking about patient safety, which is indeed so important, let me ask Dr. Bakshi to speak to us now from Manipal.
Thank you, Mr. Jairam, sorry. In the 300 seconds that I have, I want to make just one point, which is that I feel that we have come at a place in our industry where our biggest enemy is ignorance. It's not lack of capital, it's not lack of good doctors, it's not lack of infrastructure, it's not even lack of skills. We have all of those. In 1986, when I was an MBBS student in our first class in pediatrics, we were told that the treatment for pediatric diarrhea is oral rehydration solution. It just takes some salt, some water, some sugar, and some lemon to fix a child. But even in 2010, we have nearly 500 children dying every day in India because people don't know that this is possible. So, that's the first part of the problem statement. I think a second part of the solution, and as a person who's been involved with hospitals a lot, is that I feel that hospitals are the biggest citadels of knowledge that exist today, sometimes more so than even a university. Because the amount of time it takes to train a neurosurgeon is what, 15 years before you start really becoming a proper neurosurgeon? Amount of time it takes to become a good OT technician, one who just fixes your vacuum and your CUSA in the operation theater, is almost a decade. So all of that knowledge is sitting inside the walls of a hospital. And when you combine these two statements, as a person who's in charge of some hospitals, I'm asking myself, what am I doing, what are we doing as an industry to radiate this knowledge outside the walls of the hospital? This has multiple implications on public health, but I think it also has implications on us as financially savvy corporations, because we have one choice that we compete with each other for the same knee joints and for the same angioplasties, and we have another choice where we go out and tell that 70-year-old man's family, when at 2 a.m. he stops talking, they don't wait till 9 a.m. to bring him to the hospital. If a 70-year-old man stops talking at 2 a.m. or wakes up with a weakness on one side of the face, it's a stroke, and there is something that can be done for it. So I think the fundamental paradigm shift that we are trying to advocate for is, we have all the knowledge, what are we doing to radiate it out into the community, and not just wait for a World Bank or a government of India to run some campaigns and some awareness campaigns that they do, which is commendable. There's a lot happening on that front. But what are we doing as industry leaders to take this out to our own communities where our hospitals are placed? So I would invite FICCI to sort of bring all of us together on that platform. And just as a small illustration of one thing that we have started to do, it's an experiment, and it seems to be working well. So I do want to share it with all of you, and I hope all of you do this. We got inspired by the way the whole field of multi-level marketing works. We have some retail experts here, would love to hear from you. Multi-level marketing, Amway is an example, goes and touches millions of people within a few weeks, within a few days. Because one person touches 10, those 10 touch another 100, those 100 touch another 1,000. That's how it works. So we created a program called Health Share, and I'll just share the highlights of that, which is that when a patient is being discharged from our hospitals, where this program is running, we invite them to a program where, suppose I'm a bypass angioplasty patient, I will go home and I'll invite 10 of my relatives and talk to them about my experience. What happened to me, how was I diagnosed, what was done to me. And this is supported by an educator who goes from the hospital and makes a very standardized presentation to those 10 people. And then those 10 people are invited to bring in their relatives for the next layer of awareness promotion. So over a period of 6 months, we have done around 400 of these programs. And I was just talking to my market activation team. By the way, we don't call it a marketing team, we call it market activation, because I think our job is to make people aware and activate the awareness. They were saying that when a lady is talking about breast cancer that she has undergone, and she has 10 relatives or friends in her house, people cry, because it's real connection. Somebody they know has undergone this experience and is wanting to share that knowledge with them. It works very powerfully. Now, of course, this is probably one out of 100 ideas that might be deployed. I'm delighted, yesterday in the newspaper I saw Apollo has launched an awareness campaign, and I think those are the sort of industry-wide initiatives that all of us have to undertake, because I feel ashamed of the fact that 500 children in my country are dying because they don't have awareness that a simple ORS, which is lying in their kitchen, can save them from that death. I feel I'm embarrassed about it, and I hope all of us take that ownership, that we do whatever is possible in our field, in our homes, in our companies, in our hospitals, and not just keep waiting for some government of India to run a campaign and say, let's do more awareness. What are we doing about it? Thank you.
Thank you, Dr. Bakshi. Obviously, to promote knowledge about all these diseases would be really so very important. But let me ask you, in terms of your own experience between being a neurosurgeon and an administrator, do you feel that better knowledge can be imparted by your physician community? Is there a need for them to understand the importance and value of such activity?
Yeah, I think it's a great point. As a doctor, we are taught that our customer, actually the doctors hate the word customer, and many of you would have faced that, is a patient. The doctor-patient relationship is very sacrosanct, and when a doctor is looking at a patient, 90% of his attention is what is the diagnosis, what treatment do I have to give, how is this patient responding, yes or no. There is a small part of our medical education which does talk about making the family aware, but that's not really in our toolkit. I would argue, Mr. Jairam, that the solution to this is a partnership between managers and doctors. Because managers like Bhavdeep, managers like people who are coming from banking industry, people who are coming from telecom industry, know how to spread awareness, right? There are tools, there are established methods that are used, but they don't have necessarily the content of what to teach a family whose father has undergone a glioblastoma surgery. That content has to come from the doctors. So it's not one or the other, it's both parties have to work together, but the most important thing is that they have to want to work. It's not just that get me more cases and I will operate on them. It is, as a doctor, what am I doing to go out there and make people more aware of what's needed?
Thank you. With that now, I request Dr. D to speak to us. We'll probably hear a different perspective because Dr. D has an experience with Varian and is really from the United States.
Thank you, Dr. Jairam. You know, I'm going to be talking a little bit about a paradigm shift that is here today. And when we think about new things that have hit the oncology space, we think about things such as stem cells, we think about immunotherapy, but I will argue that big data, though it may sound futuristic, is here today and it's actually making an impact right now. And in oncology, this is the new frontier and it will become part of our standard practice. And I'll start this by telling you some information about the psyche and decision making of physicians. Now, Dr. Jairam will be the exception, but most of us use about 5 pieces of information to make a decision. Our brains can't process more than that. And if we think back, at least in the oncology practice, I usually know what I'm going to do in 95% of the cases before I even lay hands on the patient. I have looked at the images, I've read the pathology, I've read about the medical oncologist's consultation in terms of physical exam findings, and in most cases, I'm going to be starting with standard protocols in terms of deciding what to do. But that was yesterday. Today, we have genomic information, radiomic information, metabolomics. We have other pieces of information looking at the patient's comorbidities that can be rated in a very different manner than we used to before. How is a physician supposed to go from 5 pieces of information to make a decision to 25,000 pieces of information? And that is going to rely on machine learning. As an example, if you are a lung cancer specialist, you need to read about 7 papers a day just to keep up with the literature in lung cancer. You may be a generalist seeing all different diseases, and so how can you be expected to bring the best decisions without some other support tool? We have gone from an era where we have been looking predominantly at reporting, and we do this very well with the softwares that are in our clinics. We have about 300,000 users a day of our software and hardware tools. But we're going beyond reporting and monitoring and focusing more on the evaluation of what's happening to the patient that's under treatment now and what will happen to that patient in the future. And this is where big data is helping us. Now, Varian Medical Systems is a startup in Silicon Valley 65 years ago from Stanford University. We're still on Stanford's campus, and we make most of the world's radiation oncology equipment. 1 in 7 Americans is treated on our systems in their lifetime. And we also make the software that's used for many medical oncologists. And our future platform, which is actually here today in certain pieces, involves taking in imaging informatics, radiation oncology information from treatment planning and the EMR, medical oncology with our recent partnership with Flatiron, which is another one of these startups that has recently been funded heavily by Google Ventures, and then also information that's available for the surgeons. We're trying to collaborate all of that information, aggregate it, and make decisions. And by the way, this platform is made right here in India. Now, in terms of aggregating data, it becomes very difficult because you need to be able to protect your patient's information. These are the types of things we've been thinking about for years and have now come up with tools that allow us to aggregate within firewalls and share this data outside of an institution. With this partnership of different institutions together, we can actually make decisions for our patients that will lead to higher quality of life and higher survival rates. This also allows us to deliver patient-centered precision medicine, tailoring things to not just their performance status, but also the biology of their tumors, and we can do this at the point of care. I'm going to give one example here very briefly that probably can most be appreciated by our Dr. Roth here in the front row, who is a medical physicist. His life has gotten very difficult over the last decade. We saw some examples of how we need more clinicians per patient. Well, the medical physicist is one of those people that used to be able to handle 30 patients at a time quite easily. Now it's down to 8. And part of it is because the safety requirements and the technology have become so complicated that they're doing a lot more work in the clinic per patient. Well, we have now come up with tools that can take the best examples of specific treatment plans, such as in head and neck cancer. For example, if our colleagues at Fortis have treated hundreds of head and neck cancer patients, we can take the best treatment plans and we can come up with models very quickly that will be able to be adapted for every other patient that's being treated with that diagnosis. This treatment planning often takes 1 to 2 weeks to do a good job on it. Now we can do it in 15 minutes with a much better degree of quality, and these are the types of tools that are being available to our customers now that is going to be quite disruptive to the way that radiation oncology is practiced. The most important aspect of this, though, is that you need to be able to share this data with other institutions and with other healthcare providers. And we've actually created an infrastructure to do this that is free to use for any of our customers, that they can download each other's models, for example. And so if they wanted to do the best-in-class head and neck cancer treatment planning that Fortis has, for example, Fortis can publish their model in this portal and others can download it. And this is the direction that we're taking healthcare from a varying perspective. The other thing is that we're using all open source interfaces. We're using APIs so that investigators, institutions, they can do their own programming on our systems and actually take the software to the next level without depending on the manufacturer. And this to us is going to be very critical to advancing the way that oncology is practiced. So thank you.
Thank you, Dr. D. I will now ask Somil to speak to us.
Thank you, Dr. Jairam, and it's a privilege to be here with what Bhavdeep referred to as the A team of healthcare. It's looking at managing the coverage for the poor with government financing in toto. So not asking the poor to contribute, but finding a way to finance treatment for them. And also trying to look at greater flexibility in public hiring, looking at how to better engage the private sector, looking at how to use accreditation for patient safety and quality. And it's trying to strengthen accountability. It's trying to change the way stakeholders interact. It's trying to do more arm's length delegation, more output-based financing, better data analytics, not just in a sophisticated environment like oncology, but across the whole spectrum of public health and health financing. And it's trying to empower citizens with better information and making sure that systems are more accountable to them. But these will mean new risks. The new paradigm is far more complex. The new paradigm is not as simple as hiring people and paying them salaries or paying a fee-for-service system to doctors. This is more complex. It means that there are political and technical challenges that this will bring. It also brings the risk of broken promises. So I may promise more than what I can deliver even when I am trying to be contractually liable. And there is, despite a lot of data being available, the world is still struggling with very little use of this data, very little monitoring and reporting, even in fully automated systems. Finally, fiscal sustainability could be a challenge. Fortunately, the new generation health programs that many of these countries have launched are actually not spending too much. On an average, they spend about 0.4% of GDP. But they leverage a much larger amount of health spending by focusing on improving the performance of the money that underlies. We call it the tail wags the dog. So you invest in a little bit that leverages performance of the whole. And that's what the world is trying to do and trying to do in a smarter way. That's the new paradigm that we will need to work with as we move forward. Thank you very much. As always, a pleasure.
Very, very crisply and succinctly put. I've been watching the time. I know we've exceeded. I don't see Shobha around, so I'm pleased. I hope she doesn't come in for the next 5 minutes when I ask Mr. Rajendra Pratap Gupta to speak to us. And I'm afraid with this constraint of time, I'm not going to permit questions, but I'm sure the panelists will be available for the next 10-15 minutes till the next session starts to answer any questions from the others.
Thank you, Dr. Jairam. So I have to talk about the paradigm shift and digital health. Ironically, I don't have a presentation when we talk of digital health, so it gives me flexibility to start and stop anytime. So let me tell you why this paradigm shift. See, healthcare and medicine is global. So I'm going to touch upon 2 points of why this shift is happening. So these are 2 examples. So morning we saw Sangeeta Reddy talking about Kaiser Permanente. So last year I was having dinner at one of my friend's place in Washington. And he told me because of the telemedicine program started by Kaiser, their family has shifted to the insurance scheme of Kaiser. He said, it's so easy for me to reach out to a doctor, get my prescriptions at home. That's the first thing. Bhavdeep talked about patient empowerment. See how digital technologies are empowering the patient. The second thing is about a company that my friend started. He's an Indian. And that's the first company to have a US FDA approved app, which is now prescribed like a drug. So software is a drug. I wrote an article about these 2 things early this year in Atomic Times. So you see one side, the world, how they are embracing digital health, and now look at the opportunity or challenges in India. So the challenge in India is you have a mismatch of resources. There is one side a shortage, and there is other side a distribution problem. The second thing you see is 110 million senior citizens. Mental health, 10% of the population suffers from mental health issues. And the number of psychiatrists in India, we know the numbers. Look at chronic patients. It's not about prescriptions, it's about behavioral change. So every challenge in healthcare is an opportunity for technology. And that is digital health. So what is the paradigm shift expected in India? Let me talk about the 2 things that are happening. All of you should be aware that the government has decided to set up the National E-Health Authority. All throughout, we have looked at e-health, telemedicine, there have been programs, ad hocism, things have come, they've gone. So the first time we're going to see something coming out through an act of parliament. It's going to run for adoption, for technical standards, legal frameworks for telemedicine, e-health. That's a big shift that's going to happen in this country. The second thing is, we are all talking at this forum. We are talking among ourselves. Maybe some notes will go to the minister or the ministry, and they will look through it. The other thing that happened early this year, on the 5th of January, 6th of January precisely, the government issued an order to say, let's set up India Health Information Network. Now, that will act as a think tank platform for the government, where it will work with the private sector and with the government. They will talk on issues related to digital health and adoption. So it will become like a regular interface to give inputs to the government. The biggest shift that I should lastly address is we have always felt that things don't happen because there is no political will. And the political will doesn't happen because of the lack of political understanding. So the first time we have a Prime Minister who's taken a mission of 3 and 4 key programs. Swasth Bharat, Beti Padhao, Beti Bachao. Then we have Digital India. So the vision, I mean, it's just a coincidence that I have been a part of this when writing the policies of what was the thinking. The thinking was, let us empower every individual, every household digitally. Health becomes a very integral part of it. I'll give you an example about, I was not a part of the meeting, but this is what I was told. The PM was reviewing health sector a few weeks ago. So he asked, okay, so there are so many insurance schemes running, so many things happening. How do I know how many Indians have used how many schemes? And people didn't have an answer. Probably we don't even have a system. So his thinking, his understanding is pretty clear of what kind of technology adoption he's envisioning in this country. So it gives you a sense of how the few years, we'll see technology adoption. So we'll talk about the universal health coverage. The moment we start moving towards universal health coverage, there's going to be an issue of payers, and there's going to be issue of provider and health seekers. There's going to be issue of protocols and standardization. How do you do that without technology? So technology will come from periphery to the core. That's the big fundamental shift that we're going to see. And I just wanted to touch on these points rather than going too much in details, and that's what I had to say. Thanks, Mr. Chairman.
Thank you. Thank you, Mr. Gupta. I'm sure that the vision that the Prime Minister and all of you have would definitely help in moving forward. But just as a quick comment, I'm sure you're addressing the issues of the medical terminologies and so on and so forth with the EHR?
Yeah. So not that I speak here, I represent HIMSS, so I wear this hat and HIMSS hat. We are a not-for-profit, so we're talking on that. So I understand there was a committee formed a few months ago to decide the standards and protocols related to medical terms, which was with NHSRC. So yes.
Thank you. Ladies and gentlemen, as you can see, we've had a very, very comprehensive discussion this morning. It would be unfair for me to try and summarize everything that we've heard, but I am sure that the very crisp statements and presentations of each one of the panelists and the speakers before that is well impinged in your cerebrum. I only have a couple of statements. I'm very pleased about the terminology A-team. The question is, who is the A-team? The A-team is not seated, not the 6 people seated here. The A-team is really everyone out there who has to wear the thinking cap and decide, what can I do to make a change? Because change, ladies and gentlemen, is inevitable at this point in time. Whether you like it or not, the change is upon you. It is how you guide that change and how well that you adapt to it that will make a difference. It will make a difference to you and to the community. And therefore, let's shake ourselves up from slumber and start running, because we've lost time and we need to catch up. With those words, I bring this session to an end, and I thank the speakers and all of you for your participation. Thank you.